Greetings. My name is Tanisha Dandridge. I am a licensed acupuncturist in the state of California. I am the owner and operator of Everyone's Place, Northern California's only mobile acupuncture service. And today I'd like to discuss with you the use of acupuncture in the treatment of post-traumatic slave syndrome and post-racial battle fatigue. Post-traumatic slave syndrome is a term that is coined by Dr. Joy DeGruy in the self-titled work, Post-Traumatic Slave Syndrome, and post-racial battle fatigue is a term that is coined by W.A. Smith in a paper entitled Higher Education and Racial Battle Fatigue. The thing that marks both of these syndromes is the stress that people of color are put under due to the nature of racism in the United States. Racism and the trauma it causes is now being linked to the health disparity gap that is experienced in the African American population in the United States. For most of the 15 leading causes of diseases, including heart disease, cancer, stroke, diabetes, kidney disease, hypertension, liver cirrhosis, and homicide, African Americans have higher death rates than whites. The health disparities also extend to the reproductive health of African American women, who have a higher rate of preterm labor, lower birth rate, infant mortality, postpartum complications, endometriosis, and fibroids. This is true even when you adjust for social political factors. Perceived racism has even been linked to decreased kidney function and cardiovascular disease. So with that being said, how can acupuncture help? Acupuncture is uniquely suited to treat people who have high levels of stress and emotional fatigue. In fact, emotions are actually an etiology of disease in traditional Chinese medicine. For example, liver qi stagnation, a common diagnosis in traditional Chinese medicine, basically means that you're experiencing stress. Two protocols that are very easy to utilize in the treatment of stress include the NADA protocol and the auricular trauma protocol. The NADA protocol consists of 5 points. The first is called autonomic, which helps to calm the nervous system, the fight-or-flight system, and helps with overall relaxation. Shinmin, this point is a bidirectional point, which means it can either have a calming effect or a stimulating effect depending on what the body needs. It is often used for pain, anxiety, insomnia, and stress. The kidney point is wonderful for calming fears and healing the internal kidneys themselves, and the lung point, which promotes inspiration and helps the patient to let go of grief. The last point in the NADA protocol is the liver point, which is wonderful for detoxification, blood purification, and helps to quell aggression and irritability. The auricular trauma protocol consists of 6 points. The hypothalamus, which stimulates the parasympathetic function, calms, centers, focuses, and helps with decision-making as well as anxiety control. The amygdala point helps modulate irritability, anger, fear, and aggression. The hippocampus point has a lot to do with memory storage and emotional experiences, as well as concentration. Master cerebral is a great point for psycho-emotional, psychosomatic problems, emotions that come along with chronic pain and even the pain itself. Point 0 is a very strong auricular point for the mind, the emotions, and homeostatic balance for the body. And then there's Shinmin again, which again is a bidirectional point. It either has a calming effect or an invigorating effect depending on what the body needs, and is often used for pain, anxiety, and depression. Thank you for joining me today, and I hope that you will be able to utilize one of these protocols in the future to help treat your patients. My name is Tanisha Dandridge, and have a wonderful day.